There are some plastic surgeons out there who say you should never have a thread lift. I disagree. I have plenty of plastic surgery friends who do thread lifts. I think anyone can have threads. They're going to help the quality of your skin no matter what. There is no right or wrong for thread lifts. They're just better techniques, but you'll want to use the right thread. So I'm going to go through the thread morphology, barbology, and talk about why I use certain threads in certain ways. A little bit about me. I am a dermatologist out of the suburban Chicago area. I also see patients in New York, and thread lifts are trending in the Midwest and the Eastern Seaboard. My practice is 100% cosmetics. I do a lot of hormone replacement therapy and peptides and sexual health. I do train for thread lifting. So about Benev. Benev actually distributes threads directly from Dongbang Medical. They're the largest PDO manufacturer in Korea. I've actually seen the factory. So what are PDO threads? Why do we use them? Number one, they're not permanent. I was using permanent threads back in 2006 in my fellowship, and we liked the results, but there were definitely complications. So those permanent threads were pulled off the market a couple years later, and since then there's been multiple iterations of non-permanent threads in America. We like PDOs because they do absorb over time with a non-antigenic, non-pyrogenic reaction, and they do build new collagen. So why do I offer threads in my practice? I like to have weapons against descent and deflation. We're all treating aging here, right? Our patients are sinking and sagging. So threads complement your injectables, your energy-based devices very well. And yes, it's okay if you want to have plastic surgery. Threads actually make your skin healthier. You get better collagen after a thread lift. So it's totally okay to have a facelift surgically after you have your threads. There are some plastic surgeons out there who say you should never have a thread lift. I disagree. I have plenty of plastic surgery friends who do thread lifts along with their plastic surgery patients and have no issues. Threads are very cost effective. What I love about them is there's instant gratification. I'm not a patient person. I talk fast. I'm a New Yorker. You see the instant lift after you do your thread lifts in patients. You get the long-term collagen growth too, so there's long-term health benefits from thread lifting. So what do threads do? So I explain to my patients, we have fat pads with little fiber septae in our skin, and then we have the overlying skin that's attached. So threads, little hooks and barbs, they hook onto these fiber septae, they pull and lift the skin out of the way, and then we staple these fat pads into place. Then you get the new collagen that grows in to keep that skin lifted and more healthy over time. We're supporting the line of ligaments, right? So you're putting your threads around these ligaments to help to lift them out of the way, because as we age, we get those speed bumps, those hollows where these ligaments attach. So really great for jowls, really great for droopy cheeks without adding unnecessary volume, because patients are afraid of facial overfilled syndrome. They see the celebrities with bad filler. Threads really take away that worry. So these are how threads work. We have barbs on top and barbs on the bottom. And so depending on how the thread's inserted, whatever's on top are your fixation or anchoring barbs. Whatever's on the bottom, the more southern part of your face, they work for lifting. And then everything meets in the middle, and that's where you're getting the most lift. And so under the microscope, after you put threads in, you see new collagen. Yes, this is healthy collagen. You can see this is very non-inflammatory under the microscope. So why Miracu now? Well, number one, quality, right? Quality and safety. So these are molded threads. These are not cut threads. And so the problem with cut threads, how they're manufactured, they'll take a piece of string and they'll slice directly onto that string to make those little barbs. The problem with that is if you pull them too hard, if your patient yawns, those barbs will pop right off, and the thread actually, there's not doing any more lift. So you're increasing the tensile strength with their molded thread. Miracu, these are not repackaged threads. They come directly from the manufacturer. There's other companies in the country where they will take the threads, take them out of the packaging, repackage them with their own labels. The problem with that is the thread integrity does go away with exposure to air, exposure to moisture. So these are coming straight from the factory. And individual packaging, which I love, because if I use one thread here, two threads here, I don't have to go through a whole pack of 4 or 10 exposing them to light and humidity. And then we get to barb design too. So this just shows the difference between molded threads and cut threads. If you look at the bottom, conventional cut threads, they are sliced into that string. Once a couple of weeks later, those little barbs will actually be gone under the microscope, and so that thread lift will kind of go away after a couple of weeks. So Forte Basic is the working horse in your practice for thread lifts. These are threads bidirectional. You have your anchoring barbs, you have your lifting barbs on the bottom, and you could see with the barb design, this is not too little, not too small, just right in between. If the barbs are too long, they're not going to be strong enough. The skin's going to flop off those barbs. If the barbs are too short, the skin's not going to hook onto them. And then you have your Forte Fixes, which are really interesting threads. These are fixation threads. What do I mean by that? Well, we do our lifting threads, usually in a vector that goes in this direction. I like to add my fixation threads on top to staple in my lift. So these are threads I crisscross. I go not in this direction, but I make other entry points to make my threads go across my lifting threads. Why? Number one, to spread the tension, the weight of the skin across all these threads, which I think gives you better longevity. Number two, to increase my collagen contact points. I have my lifting threads going this way, I have my fixation threads going obliquely across my fixation threads. I'm making new collagen contact points, and research has shown that you're getting 3 to 5 times more collagen when you have those contact points versus just a single thread alone. So better longevity, better skin quality. These fixation threads are cool. They have a butterfly barb design, so they're very, very grippy, like Velcro under your skin. Then we have the mesh fills. These are really fun threads to use. They're like a tube of 16 smooth threads wrapped around each other to make like a tube, and you can actually put them under the skin for instant volume. They work great in folds because you're not going to get migration like filler, but you also get increases in collagen in that area, and you could also put filler through this. So look at that. You can actually put this little cannula onto your syringe of filler, inject that filler once you place your mesh thread, and you're going to have a scaffold for that filler to last longer, decrease migration, and have better results over time. Elastiline, these are the threads I love the most. I use these a lot in my practice. So these are like your bidirectional lifting threads, but you have an anchoring cog at the tip. If you look at the cannula, I'm going to focus on the cannula over here. If you look at it, there's no thread hanging out of here. You have an anchor cone that looks like this at the tip. So really strong fixation, because most threads will have that thread that comes out of the cannula, and the actual barbs for fixation are inside the cannula. So when you put your threads in, it's a little bit less precise, that fixation point. So these are very robust. They're 17 gauge, really nice lift and really nice duration. So if you look under the well, this is not under the microscope, but this is what threads really look like up close. Traditional, these are your smooth threads. You have no barbs. And then these are the cut threads. Well, you have these little flaps that stick off your threads. Problem with that is they break very easily. Patient yawns, that thread is broken. And then you have these kind of keyhole cuts made where the barbs are really not that long, so not very grippy and not really great tensile strength because you're actually cutting into the thread itself. And then you have more traditional molded sutures, which work really well, but look at the elastiline. The barbs are just that much more long and robust, so really nice lifting with these elastiline barbs. So common areas are treated. Well, we're working against gravity, right? So people hate the nasal labial folds, they hate their jowls, they hate the foreheads that are coming down. These are kind of traditional vectors. I like to add my fixation threads, like a little hook and ladder technique, across my lifting vectors to give more support, more dispersion of that tissue tension and weight across the tissue. I think I get better results because of those extra contact points I'm making. So anatomical considerations, where do the threads belong? When you do threads, they're in the deep fat above the SMAS. You're looking at your potential anchoring points out in the temporalis fascia, behind the ear where there's thick fascia that doesn't move. You want to anchor into non-mobile areas. You're thinking of your facial ligaments you're trying to support against. People hate the speed bump in the cheek hollow. They hate the jowl where you have that ligament right over there. So you're supporting the weight of the tissue away from the ligaments to keep that lift. Areas of saggy skin versus hollowing. You don't want to make a patient look more fat and wide. Most patients want to look more V-shaped, and how you angle your threads will determine how you make their face wider or more narrow by redistributing the volume. So ideal candidate, well, of course, ideally, they would be not too old, not too young, could have some looseness in their skin, but not too much looseness, right? But in reality, we don't get patients like that. I think anyone can have threads. They're going to help the quality of your skin no matter what. If you're too thin, don't use a big, thick thread. Use a smaller thread. Builds up that tissue quality too. But anyone can have threads because they got nice results with it. So procedure preparation, yes, look at your model. That'll tell you how many threads you need to use in an area. If you have very heavy tissue, you need more threads to get a result, a lasting result. The supply is really pretty easy. We do some injection numbing. We use an 18-gauge needle to make the porthole to put the threads through. Use your threads, and then you use some sterile scissors to trim the edges, and you're done. Post-procedure, ice is the best friend. So I tell patients you're going to have swelling, you may have some bruising. You can give prednisone for swelling. You could use antihistamines, water pills. I don't routinely give antibiotics. I haven't had issues, knock on wood, with injections. I say keep the face very chill for the first couple of weeks. If you move a lot, if you have big expressions, you're going to feel tight and sore because this is what we're doing to your face. I've had threads before. It does feel funny if you try to laugh or talk really big because your face just doesn't want to move in those directions for the first week or so. So yeah, don't bounce around, avoid too much exercise because the more you bounce around, the longer it's going to take for that swelling to go down. It's going to be that much more sore. And sleep on your back because if you sleep on your side, your face is not going to be happy the first week. So possible complications, dimpling can happen, and that's if you have your barbs too superficial. So if you're in the right plane with threads, when we do our trainings, we teach how to keep yourself in the right plane to avoid the dimpling. Bruising can happen, infection, yes, if you have a non-sterile technique, there is risks of that. Hair getting stuck down the cannula path too. Migration, we don't see with these types of threads. With the cut threads, because they would break under the skin, you would see protrusions and migrations under the skin, but with molded, I haven't had those issues. Temporary paresis, that can happen, but really not lasting more than a couple of weeks ever. And yes, people will swell, that is normal. So there is training, there's boot camps, there's private trainings, I do private trainings, but you learn all about the threads and also some of the other products in the portfolio. And here are some before and afters now. So if you watch me thread, I will do traditional techniques vectors, which which are basically vectors from the top down. That's traditional. Reverse is basically going from the bottom up. The threads really end up in the same place. It just depends on what you're trying to do and where you want to poke the holes and what your patient's anatomy is like. So when you see me thread live, I will do a whole mishmash of different vectors because everyone's different. But really, we're targeting the superficial fat pads to move them out of the way and lock them into place. So here's a patient. You could see we did a reverse technique on her left mid-face. She has better volume in her mid-face now. We've gotten rid of some of that jowl over there. And these are some more before and afters immediately. So on this patient, again, we have a left mid-face. We're getting rid of this tissue here that's making her look kind of hollow. So with threads, you could actually move tissue around to create volume where you want it and decrease volume where you don't want it. Over here too, a little bit before and after of the left mid-face. Probably checking she's like 70 years old around here. And she has, thinner tissue, but she does get a result with the thread lift. This is immediately during and after. I don't have her long terms in this photo, but we do see patients getting results a year, year and a half, up to 2 years. I think it depends on their skin quality, how many threads you use, and how you're crisscrossing your threads to get that longevity. So here's a patient 3 weeks after doing a mid and lower face. You can see she still has a bruise on her temple here, but pretty nice results. 3 weeks out, she was very happy. We have some patients who are babies and they're afraid of threads. So with her, I just did a mid face because we know that if you put threads just in this area, it's much more comfortable because we're not touching the areas where their mouth is moving. So it's a lot less sore afterwards. And you could see by just doing threads into the mid face, her neck and jawline look better, which we know because we're pulling here, but it does affect all the tissue south of it. So she was actually so happy with her mid face thread that she signed up to do more threads to the lower face a few months after that. Some immediate before and afters, you can see with this patient, she's very rectangular. So we made her more V-shaped with threads and kind of redistributed the volume. I flattened her nasolabial fold, but I popped her cheek a little bit more, and you can do that with threads actually very effectively. This is a patient I did actually at a live demo, and so this is her 6 months later. It's a selfie, it's not the best photo, but you can see her results are pretty nice 6 months later. She looked less shadowy, less tired by redistributing all that extra volume. And then we have a patient here, she's younger. This is her before, and this is her 6 months later. So she's someone with a very full face. I could have put filler in, but I thought threads would be more efficient at contouring her skin and making her look more chiseled, because that's what my younger patients want. They want to be snatched. And so she loves threads so much, she's had probably 3 or 4 rounds in the past 5 years. And here's a guy. So with men, they don't necessarily want to have surgery with the downtime and the scars. So he's someone who needs a surgical lift, right? But he didn't want one. So I gave him a neckline with threads, and this is him 3 weeks later. Not too much downtime. Men don't seem to swell or bruise as much as females. They have thicker skin, so much easier with downtime. And here's another guy. We love our men in the practice. We have a lot of guys. And so he wanted to get back in the dating game, didn't like the saggy neck and everything. So this is him before and immediately afterwards. And this is him 2 months after. He wore the same shirt just for me. So I wasn't thrilled. I said there's a little bit of pocketing and things I could move some more, but he didn't want any more. He was happy with his result. And so he got back on his dating sites, and haven't seen him in a while. And so here's some nose threads. Yes, okay, so this is the nose before and after, immediate, really nice results. You don't really swell too much with these threads because the nose has very thin tissue, not much places to swell. So really nice instant after results. Here's another patient treating the bridge, and you can see the tip came up a little bit, and she was very happy with her results too. We do see nose threads lasting for a very long time because the nose doesn't move. It's not very metabolically active. So more than a year later, maybe 2 years later, patients they don't come back for their noses. Here's a guy, he's 10 months after his threads. So pretty nice lift and improvements in skin quality. And here's another patient 1 year after her nose threads. She could probably have more, but she was happy. Thank you very much for listening.